Hello and welcome to a presentation on obsessive compulsive disorder by Dr. Ignatius Cole. So what is the epidemiology of obsessive compulsive disorder? Lifetime risk is 2.1%. What are the risk factors? There are genetics, and there is evidence of brain disorder in people afflicted with the obsessive compulsive disorder. There is increase in gray matter volume in the striatum and decrease in orbitofrontal, dorsomedial, and anterocingulate cortex. And since SSRI synaptic serotonin reuptake inhibitor have been found to be useful, there is abnormal serotonergic function. And psychoanalytic theories have said many claims about OCD, but they are not supported by evidence. They say there is retention in the anal phase of growth. What are obsessions? Obsessions are subjective desire, which the patient feels, which must be resisted by the patient to carry out some action, dwell on an idea, recall an experience, or ruminate on an abstract topic. So it can be a thought, or it can be a thought to carry out an action, it can be a picture, it can be an idea. There can also be unwanted thoughts, which include the inconsistency of words or ideas, ruminations or train of thoughts, which are perceived by the patient to be inappropriate or nonsensical. So obsessional urge, the patient thinks are coming from the self. So if the obsessional urge is coming from outside the self, then it is usually character of schizophrenia. So obsessional urge is recognized to be coming from the self. Compulsions are actions designed to relieve anxiety arising from obsessions. So what can be the compulsions? Like if the person thinks that he is going to be affected with a very severe disease, or then he will wash his hands. These are the compulsions. The feeling that he is going to suffer from very severe disease is obsession, and washing his hands is compulsion. The feeling that his house is going to be looted or thieved is obsession, and going and checking the lock is compulsion. These are quasi-ritual performance. Example, washing hands to deal with contamination. This compulsion is an attempt to dispel obsessive thoughts or urges, which may lead to a severe struggle with intense anxiety. So this compulsion will lead to relief of some sort of anxiety. This will relieve the severe anxiety that comes with obsessive thoughts. So the symptoms: A. If the obsessions or compulsions are both present on most days for a period of 2 weeks, obsession, thoughts, ideas, or images, and compulsions share the following features, all of which must be present. They are acknowledged as originating in the mind of the patient and are not imposed by outside person or influences. They are repetitive and unpleasant, and at least one obsession or compulsion must be present that is acknowledged as excessive or unreasonable. The subject tries to resist them, but if very long lasting, resistance to some obsessions or compulsions may be minimal. So if the obsession or compulsions have lasted for a very long time, the resistance is minimal. At least one obsession or compulsion must be present which is successfully resisted. Carrying out the obsession's thought or compulsive act is not in itself pleasurable. This should be distinguished from the temporary relief of tension or anxiety that occurs with doing the compulsive act. The obsession or compulsion cause distress or interfere with the subject's social or individual functioning, usually by wasting significant amount of time. Other commonly used exclusion criteria is that the symptoms are not due to other mental disorders. So what is the treatment? Under the medication treatment, it is clomipramine. It is a tricyclic antidepressant of historical importance. It is not a first-line drug now. SSRI, selective serotonin reuptake inhibitor, are the first-line drugs now. They have similar efficacy to clomipramine. There are less side effects and less dropout rate. Efficacy is improved by combination with low doses of risperidone or aripiprazole, which are antipsychotics. Psychotherapy can also be done, which include exposure and response prevention, cognitive therapy, and dynamic psychotherapy. Surgery can be done. Deep brain stimulation has been found to be useful. The references are Oxford Textbook of Psychiatry 7th edition, ICD-10, DSM-5, and Kaplan and Sadak Textbook of Psychiatry. Please subscribe.